My name is Dr. Xania Sofra. I have a doctorate in neurophysiology from City University in London and a second doctorate in clinical psychology from the New School for Social Research in New York. Today, we're going to be talking about novel modalities for skin repair and hair growth, and I will be talking about the hair growth first. Human hair growth has three phases: anagen, catagen, and telogen phase. The papilla is separating from the hair follicle. There is shedding, and then there is new hair that is growing. People typically lose about 50 to 100 hair a day. It's usually not noticeable because new hair is growing at the same time. Causes for hair loss are heredity, of course, genetics, hormones. Inflammation is going to be a very important factor that we're going to be talking extensively later. Gender, usually man, age, usually older. Stress, medical reasons, chemotherapy, infections like the ringworm, a type of fungus, etc. Very important, female pattern of hair loss may be viewed as a marker for an increased risk of cardiovascular metabolic disease. This is the study and the review study that has postulated this concept. And a lot of studies are supporting it. Lost hair is associated with inflammation. This is an extremely important aspect of this, because if we start understanding that and we start having future therapies that consider this inflammation cause, then we're going to have hair growth that is more substantial and will not have any rebound. Evidence and implication of inflammation as a characteristic feature of male and female patterns of hair loss are highlighted through evaluation of clinical and quantitative data. They involve inflammatory infiltrates, lymphocytes and histiocytes, inflammatory genes such as the CASP7 and the TNF. Inflammation in women with alopecia repeatedly shown by many different articles. And there are several treatments, of course, stem cells, and very effective in hair loss. Other hair treatments include topical agents like caffeine and metformin, oral agents, pharmaceuticals, nutraceuticals, and platelet-rich plasma. Energy-driven therapies include fractional lasers, low-level laser therapy, laser-assisted drug delivery, that is a combination of different treatments, supplementation, and platelet-rich plasma and low-level therapy combined, and other combination treatments. So lasers are basically used both for hair removal and also for hair growth. The issue with most of the studies, both laser and radio frequency, is statistical significance. So it's not clear that everybody gets the result or there is statistical significance. There are several reports of escalated inflammation following radio frequency procedures. Radio frequency could be replacing pre-existing inflammation in hair loss process with radio frequency that induces inflammation. So we conducted a clinical study with a novel technology. The results are after 3 or 4 treatments before and 3 months later. Clinical studies on hair growth. This is after 1 treatment, before on the left, after on the right, and after 3 treatments. Here it's the opposite because we have the after on the left and then before on the right, and you can see a substantial hair growth on the left side. Again, a substantial hair growth on the left side. The after is on the left. You can see how thicker the hair is on the left slides. And again, you can see a substantial hair improvement, hair growth on the left slide after 1 month. Now let's go into the skin. The skin responds to injury with a series of dynamic processes: coagulation, inflammation, tissue formation, and remodeling. The reason why I'm talking about injury, it's because that's where you can see if there is an effect. Because if you can see the effect in an injury, then you can see it from facial rejuvenation. Dr. Lamb and I did an article on technological advances in accelerated wound repair and regeneration. We used the same technology that we used for the hair. And again, if you look at all the literature and you compare our article to everything else, is that you see is that inflammation is a core determinant of abnormal healing. Embryonic wounds heal normally, but as you are aging with chronic persistent inflammation, you develop scars and hypertrophic scars and keloid scars. Signaling processes are also at the core of this process. Dysregulated or overly excited signaling pathways underlie abnormal healing. Neutrophils are there to kill certain microorganisms. Macrophages are there to clear apoptotic cells and develop early closure. However, what we have seen is that if the ligand 2 signaling is increased, then inflammation and scarring is increased. And if you obstruct ligand 2 signaling, what you see is reduced inflammation and scarring. Also, mast cells release histamine and other substances that ultimately result in scar formation. Therefore, you can, in animal models, you can have entirely normal healing if you genetically deplete mast cells. So dysregulated signaling is abnormal healing. Basically, the process begins, but because of inflammation and the faulty signaling, it continues as an aberrant event without stopping when it's supposed to stop. And that's when the scar and the keloid scars are formed. The different types of lasers, some of them ablate the keloid, and some of them basically cause necrosis of the keloid without removing the keloid. However, there is all the laser papers that I've seen, and I'm not sure if I've seen all of them, what we find is that the statistical significance is just not there. So yes, there is improvement, but about 34 to 24%, they get no results. And 21 to 35%, they have reoccurrence of keloids. In several studies, laser investigators report a significance of 0.01, but when you look at the results, you find that only 8 out of 22 subjects, that's only 36%, had a clear reduction in the size of their lesions. 10 of these subjects had a slight reduction, and 18% showed no change. Therefore, it cannot be 0.01% because that's 99%. In our body, when our body is injured, there are these endogenous electrical fields that are formed that the body creates to heal itself. So obviously we can create that with a technology or through a chemically induced pharmaceutical. There are some articles that have shown that microcurrent stimulation triggers the MAPK signaling pathway. That's a very important signaling pathway because it communicates the signal from the receptor to the DNA that express the protein to cause the cellular changes like hair growth or cell division. The transforming growth factor B1 is also very important, and they also found there was an increase in that factor. That factor controls cell growth, cell proliferation, and differentiation. Research with ionic currents has shown that soft tissue healing is enhanced. There is an increased secretion of growth factors and an increased adenosine triphosphate production, the ATP. And this you can see the before and afters of the wounds and how the wound is closing and start healing substantially. Permanent healing by ultra-low microcurrents in the management of diabetes mellitus, hypertension, and chronic wounds has a number of articles that have come out. And here you see Dr. Waddell, Dr. Lee's biopsies, and you can see a substantial improvement on the wound injury in diabetic wounds that are very difficult to heal. How does this work? Okay, very interestingly, less is more in this case. So you don't need this high energy to penetrate the skin. The ultra low energy creates a resonance at the ion channels of the cells and controls it. It actually amplifies it. And at that time, you can insert different signals and repair the signaling pathway that is damaged. Very interestingly, electrons are extremely useful in replenishing free radicals. And when you do that, they clean out the DNA. Because if there are too many free radicals in the DNA, there's going to be breakages in the DNA. And by replenishing the free radicals, they turn the free radical back into a stable molecule. You see this process routinely happen. This is like a back and forth process, like a time reversal process, with the GDP becoming GTP, ADP becoming ATP, and then back to ADP, and they go round and round routinely. It's very interesting. The novel technology we utilized works with resonance. It releases 4 harmonized signals that resonate with biological processes every 3 to 8 seconds. These harmonized 4 signals, released at various time intervals, are delivered in sequence that is also harmonized, meaning that the signal before and the signal after resonate with each other. This complexity of resonance affects a large number of biological processes and starts with the electron-gated ion channels in the cell that will affect the behavior at the synapse, information transmission by neurotransmitter signaling pathways, and then in mending the signaling pathways by inserting different signals through the ion channels. This is what resonance is. It's a mathematical concept. Basically, when 2 waveforms are in sync, they add into each other. When they're not in sync, they turn into 0. What you see here is how resonance energy transfer between proteins is affecting the proteins and can cause repair and communication. And the most interesting part about resonant energy is that it does not involve the production of heat. This is some of the Jablonski diagram of how this resonance transfer happens from one to the other, and this is a microscope on how you can observe it. Signal processing blueprints analysis is how these signals are made in our technology, and basically require ultra-low energies, target molecular mechanisms prone to time reversals, develop blueprints of biosignals, establish resonance, and control timing. And this is how it's basically made. And you can see here the different waveforms and how they're kind of added up onto each other to form a resonance. And you see if they're editing correctly, they turn into 0. And this is our clue of what works, what does not. The importance of timing is paramount. The same signal emitted at different times can enhance or suppress cancer. Every cell in your body is controlled by its own circadian clock. And there are clock genes that basically are developed to control that. Disruption of cellular circadian rhythms is followed by a disruption in cellular communications. And that's the Nobel Prize in Physiology and Medicine in 2017 that basically was given to finding the timing of the cell and how important that is in developing cancer or stopping the process of cancer. Recent studies have already linked the skin circadian clock to psoriasis. Psoriasis is inflammation, basically due to the disruption of signals delivered at a time schedule outside the required range of cellular circadian clocks. And this is a study that was done by Veronica Yap in Singapore. That's another example, another patient that she provided. These are diabetic wounds before and after. That's the before on the left, the after on the right. After 8 treatments, you can see the wound is completely healed. This is a liposuction wound that started as a necrotic wound and ended up in a scar. This is a postoperative skin cancer wound before and after 6 treatments. A diabetic wound after 6 treatments. 1 year later, actually we have now 2 years that we have observed this patient, there was no reoccurrence. This is a herpes zoster case. As you can see, a significant difference in 2 treatments. Again, very significant difference in 2 treatments. This is an accident wound. This patient was told he will never be able to use a hand. This is keloid scars before and after, another clinical study that we did on keloid scars. This is a study we did on stretch marks. This is just one treatment. Pigmentation is also reduced significantly. Again, only one treatment of 20 minutes. This is a before and after of rejuvenation and hair growth combined. How can this happen? Can we really unboil an egg? Can we go back in time? And the truth is, yes, we can by refolding proteins. So in unboiling an egg, we can develop better cancer treatments. Skin disorders can be reversed by refolding denatured proteins. There's a lot of research on this subject at the moment. And protein refolding occurs routinely inside our bodies under the supervision of chaperone proteins. However, now several scientists have succeeded in folding proteins by using surface plasmon resonance. And even though it's a new technology, we already have a measurement test, the second virial coefficient, SCV measurement. If it's negative, the protein aggregation increases. That means the protein is dysfunctional. If it's positive, the protein aggregation decreases. That means protein refolding is successful and the protein is functional. This is what protein folding looks like from the beginning to the first to the fourth image. And with this, I would like to thank you very much for your kind attention and for inviting me in the BIOM conference. I'm very grateful to be here with you today.